This is Dr. Pratap Chandra. I'm the neonatal consultant and consultant lead for Motherhood Hospitals, Bangalore.
Hi, I'm Dr. Suresh Gowda, consultant neonatologist and pediatrician working at Motherhood Hospitals, which is based in Indranagar and Nagar.
Very proud to say that we have developed a level 3A center at Indranagar Motherhood. What this means is we can look after extremely preterm babies, which means babies born 24 week onwards at least. We have looked after babies less than 500 grams as well. And we can also do specialized ventilation forms like volume guaranteed ventilation as well as high frequency oscillation ventilation. I'm also very happy to say that we have developed skills to look after neonatal surgical babies, and the team is well versed in looking after babies who's needing inhaled nitric oxide or those babies needing total body cooling. Just want to quickly explain what this total body cooling is. This is a novel new methodology where the babies who are born with birth asphyxia, or those babies who are born and did not cry after birth, will have suffered lack of oxygen and blood supply to the brain. So in these babies, the outcome can be very poor, which means they can either die or they suffer quite a lot of neurodevelopmental disabilities. So in these babies, we cool the babies to 33.5 degrees centigrade for 3 days and then rewarm them very slowly over the next 8 to 12 hours. And by doing so, we are ensuring that the further damage to the brain is limited. And I'm very proud to say with the new neonatal unit, what we've got for the last 6 months, we've already cooled more than 7 babies. We do ROP screening in the unit, and we have tied up with good ophthalmic hospital where the team from their experienced consultants will come in and then do the ROP screening for all our babies, and it is very much protocolized, and the success rate is almost 100% for screening of the eligible babies. And we also have undertaken few laser treatment for advanced ROP or the ROP plus diseases in our center. We have in our team doctors, neonatologists who are well trained in undertaking ultrasound procedures, and we as an intensive care unit, we strongly believe ultrasound would act as an adjunct to your clinical tool. So we undertake bedside ultrasonography of the brain. We also do ultrasound of the lungs, the ultrasound of the abdomen, and also we do echocardiography bedside in our NICU. We also are tied up with a cardiology team to assess all our echoes and give us the reports. And we also do screening echoes as well as confirmatory echoes in the unit. The other big thing what we want to take it further would be in terms of point of care ultrasound, looking at the position of the lines, for example the endotracheal tube, the position of the UAC, UVC, or even the long lines. Extreme preterm babies also need the care and the warmth and the love from the mother, and we emphasize on the Kangaroo mother care in our unit, which means keeping the babies on the chest, on the bare chest of the mother, thereby enabling a skin-to-skin contact with the baby and the mother. This will not only ensure that the warmth is given, the love is transferred, as well as it will emphasize the good developmental outcome for these babies. We should never forget that having an extreme preterm or sick babies is very stressful for the parents and the family. By enabling them to be together, caring and loving and sharing all the time, we are making sure that a very good, a strong bond is developed between the baby and the mother. We take care of the bedding of the baby and make sure, that they are swaddled at the right time, they're actually given the warmth at the right time, KMC at the right time. We also introduce tactile stimulation, visual stimulation, auditory stimulation, as well as the oromotor stimulation for these babies from 32 weeks gestation onwards. This will enable them to develop naturally, as well as avoid them some of the contractures that may develop, some of the spasms that they may have, and thereby ensuring that extreme comfort is given to these babies.
We do have a dedicated neonatal transport team which is in par with international standards. We do fetch in babies as far as 800 kilometers across Karnataka and in and around bordering Andhra Pradesh and Tamil Nadu as well.
We have state-of-the-art transport incubator with the ventilator facility, wherein we can go to places very far and transfer the babies who need high level of intensive care. So we have developed transport teams wherein we send in a neonatal nurse who's very well qualified, along with a junior consultant who's usually post fellowship in neonatology, and they will go to far off places. For example, Bellary, we have retrieved babies from Mysore, retrieved babies from Kadapa, some parts of Andhra Pradesh, Tamil Nadu, Tumkur. All these places which are far off, we get these babies referred because of the belief of the referring team about the systems that we have in place and the processes that we have in place.
This is our outbound unit, where we can see that we have almost 7 or 8 babies in our outbound unit. These babies have been referred from different hospitals. One from Tumkur, Bellary and Chitradurga, and also from different centers of Bangalore hospitals also has been referred.
That having a preterm baby is an extremely stressful situation for the parents, but obviously I would like to say that they being here at the right place at the right time and with the right team, which would in addition give a positive and a good outcome for the baby, and we would like to see the joy on the parents' face.